HIPAA laws will kind of dictate that the providers cannot disclose personal and health information of their patients to anyone else unless they get written approval, like they get a release of information. So what that means is if you call or write to your child's therapist or psychiatrist, one is that they might not be able to reply or confirm that they are seeing your kid, right? So if they can't write back and be like, "Thank you, I am your daughter's therapist and I will, take this into consideration." Even that's a violation of HIPAA. So they might not be able to reply and they might not be able to confirm that they are working with your kid. And they will tell your child. They have an obligation. And I think maybe providers might have different rules around this, but generally the provider will tell their patient if their family member has reached out. So don't be surprised if your kid is like, "I heard that you emailed my therapist or called my therapist." They're going to do that. And it's not really a betrayal of trust. Like, they are your kid's provider, so their responsibilities are to their patient. But what this does mean is that you can talk to your kid about, would it be helpful for me to join a session or to communicate to your provider? You can see, you could, like you could hear exactly what we said, but, I just want to know if I can be helpful in any way. And if you are having a really hard time or more scared about your mental health, like, how can I reach out to your therapist? Or is there a plan? Is there a safety plan? How can we coordinate so that we keep you safe? When is it okay for me to reach out to them? I imagine that most people don't want you to talk to their therapist, of course. And I still think it's important. This is me speaking from my clinical lens. But sometimes that information that you have is really important for their therapy, right? Like, if they're going into therapy and they're not disclosing that I had an episode, I try to hurt myself, or I was violent towards my parents, that might not come up in their therapy. They might choose to talk about something else, but it might be important for that therapist to know, right? Especially, if there's a safety risk or if there's possible side effects of a medication they're on. Like, it is helpful to know if there are serious risks involved. So what you could do, and I know this is risky because, it might get back to your kid, but you can email or leave a message for their therapist or provider or doctor or whatever, and just say, "I am so and so's parent. I know that you can't share any information with me. I just want to let you know that this happened. I'm aware that you have to communicate this to my kid, but I just thought it would be helpful for you to know. And I am open to anything that could be helpful." So that might be a way of doing this one-sided, like, team coordination where you're like, "I'm going to just share with you this information that I think is important. Don't start putting in all your feelings and opinions there. Be really factual. Be like, they got up yesterday, they were acting this way and they didn't eat and they threw this, they got upset and they threw this thing at the wall, right? None of this like, he went crazy and, like, I don't even know what to do with him. He's nuts and you got to fix him, right? Don't put in your opinions about it because they're definitely going to get back to your kid, but just be very factual and explain to them any information that could be helpful, especially if there's drugs or medications or other kind of safety risks involved.